I see 1 p.m. on my computer, so I want to be respectful of everybody's time. So we'll go ahead and get started. My name's Brenda Loop. I am the data specialist at CCR&R, and then I supervise the community development staff. We're all on the session today, and we'll be monitoring the chat. I do have everybody muted right now, but if you have a question that you want to ask, you can unmute yourself and ask that question, or you can type them into the chat. Anything that we're unable to answer during the session today, we can respond back to you in an email after the fact if there's things that need to be researched to answer your questions. We do have some partners on the call also from DHS, so if there are questions that they can help answer, Ryan is available to do that as well. We have Heidi with us. She's going to do most of the talking today, so I'll mute myself here momentarily and just kind of stay in the background. I'm here for help if anybody needs it. If you can't figure out how to use the chat, or if you're having problems muting or unmuting yourself, or hearing or seeing anything like that, just feel free to reach out to me. You should have my email if you got the invitation to this meeting. And with that, I think we'll just go ahead and turn it over to Heidi, and she's going to get us started today.
Great, thanks a lot. Can you hear me okay? Okay, I'm going to go ahead and share my screen, and I have a kind of a PowerPoint and just to keep us on track, but I know a lot of you probably have questions about the new guidance document that was posted, and we are going to talk about that. So I'll go ahead and start sharing my screen. Just a little bit about myself. I am the coordinator for Healthy Childcare Iowa. I'm a childcare nurse consultant also. So I have been working quite a bit with all of our nurse consultants across the state for all of the questions and concerns that we've had around COVID. So it's been a journey for sure. And I just want to say thank you for allowing me to present again. I was looking back, and I think it was a month ago, if that was correct, Brenda. So I just appreciate your willingness to have me present again, and also appreciate all of you as providers, because without all of the hard work that you're doing, we would not be able to keep childcare and open and kids safe and healthy in care. So I really appreciate that. Like I said, my name is Heidi Hotvet, and I do have my contact information here in case you need it. So first, we're just going to talk a little bit about the new guidance document that was posted. So I don't know, I'll just do a little bit of an overview, and then we can, if there's some questions specifically, we can talk about that. Maybe after I kind of at least do some of this initial information. So just want to do kind of a quick overview, of course, about COVID. You know, things are changing. I think the last time we had this meeting about a month ago, we were really focused on, you know, the symptoms of COVID, and really focused on you know, what those were in terms of, you know, doing those health checks in the morning and before the day, the start of the day for staff and children. And, you know, really we were focused on, you know, fever, cough, shortness of breath. And as things evolve, we're finding out that we've known that there were some mild symptoms that some individuals were having with COVID, but CDC has expanded their list of kind of the symptoms, and anyone could have COVID symptoms that could range from mild to severe, but fever and chills still is on the list. Fever over 100.4, that's why we're continuing to monitor for that. Cough, shortness of breath, or difficulty breathing, those are the same, but they've added fatigue, muscle and body aches, headache, a new loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting, diarrhea. So that's just the list that they have now. They said the CDC has continued to add to that list, and that makes it very challenging for us in the childcare world, because if you look at that list, on any given day, it's not that unusual for a child to have a runny nose or have some congestion, or it's not unusual for a child to have a cough. It's not unusual for a child to maybe, seem a little fatigued. So it's a challenge, and I think just to recognize the fact that it is a challenge for all of us to make sure that we are providing the guidance that we need and to follow best practice so that we keep everybody healthy. So I wanted to kind of share that because that was some different information than maybe the last time we had talked. So with the new guidance document, we're really focused on the confirmed positive case. So that's a little change in our language in terms of kind of looking at that case reporting and outbreak. And this was a guidance document that, and I know Ryan's on the call, we worked between Iowa Department of Public Health and Department of Human Services, really working together to try to put a guidance document that was specific to, what do you do when you have that positive case? Because with increased testing, we are seeing increased numbers of cases in the state, and some are asymptomatic, and some have very mild symptoms. I mean, I've talked with many individuals where they're like, I thought I had a sinus infection. I had kind of my normal sinus infection that I get in the summer or the spring, and then I get tested and I'm positive, and I never ran a fever. I mean, those kinds of things that we are hearing. So we're really looking at the case reporting and response, and kind of what do you do when you have a situation that occurs. So I'm going to just kind of read some of the guidance here for the case reporting and outbreak responsibilities. So if you have a staff or child and you are notified that they have a positive case, then your responsibility is to notify DHS licensing, either your, and in your case would be your licensing consultant. Homes would be working with their compliance staff. And you should be doing that the day that you find out that positive. So that's, I know we've had something, and it's not that you cannot reach out to your DHS person and to your local nurse consultant when there's a concern about an ill child or a potential positive, but we're really just looking at this guidance document when there's a confirmed positive case, and that's with viral testing. So when you find out that that's occurred, then the important thing to do right off the bat is to determine who is the close contact to that case. And that really is looking at, of the children or staff, was the close contact. The close contact would be a person that was positive, that was within 6 feet of other individuals for 15 minutes or more. So, that's very unique in different situations. And that's where I think it's a little challenging, because every program is different. Every layout of their classrooms is different. Every program has a different system in terms of how they utilize their staff. And I'm actually going to talk about that in a little bit, but of some prevented ways. But really the first thing you're going to do is, when you find out that positive, is who are the close contacts. And then those close contacts need to be notified that they should be instructed to self-quarantine for 14 days. And that is a big challenge for programs. And so I think it's important that you're aware of that, and that is guidance from the CDC and the Iowa Department of Public Health. That guidance actually has not changed since day one with the COVID outbreak. That we've always said that if you have an exposure, you need to be quarantining for 14 days, stay home and quarantine. So that is something that you would need to make sure that you're instructing those close contacts, so that's the families and the staff. And then close contacts or other interested persons in the program, even if your staff member was just in the one room, but there's maybe other staff members that are concerned, they should pursue testing. Testing is available, readily available, and childcare was actually added to the list for testing guidelines for both local public health agencies as well as for the Test Iowa sites. So that is available. and you would want to share that information. And then also just a kind of a little highlight. So if they test and then they test negative, unfortunately, that doesn't mean that they can come back. If you're exposed and you test negative, you would still need to continue to self-quarantine for 14 days, because that testing negative today is just a snapshot of kind of what you are today, but you could develop symptoms later on from that exposure, because you're really that exposure time for you to actually convert to a positive COVID test would be that 14 days from when you had exposure to that individual. So that's a little bit about when there's just a 1 or 2 confirmed positive cases. So that's the guidance that you would be doing if there were those cases. And when you have that positive 1 or 2 cases, you're going to make sure that you're calling your DHS licensing consultant. DHS is then going to collaborate with your child care nurse consultant. And I know how it works because a lot of times, it's kind of I call this person whoever I get first is who I'm going to talk to. So just so you know, your responsibilities is to contact the DHS licensing consultant. And, if you're waiting to hear back from them, or you can of course reach out to the child care nurse consultant. But when you think about a communication tree, it really is to start with that DHS licensing consultant for you. And then they will collaborate with the child care nurse consultant, and then they're going to provide guidance in terms of cleaning, exclusion, and screening. And so that guidance that they're going to provide is that the close contact guidance, the exclusion of those staff and children, notification, of course, you're going to be notifying the family, and then the cleaning part, and actually I'll get into that a little bit into a different slide. So there is some guidelines around cleaning when there's been a positive case. So that's with 1 or 2 confirmed positive. And then there's a little bit different situation when there is a 3 or more confirmed. So when there is a 3 or more positive confirmed, and that would be in separate households. So that's a little different language than we've heard before. So say it's a staff person that is positive, and they have 2 children that attend childcare in your program, and they're also positive. That would not be considered an outbreak, because they're all of the same household. So this is 3 positive cases that are not household contacts of each other. So if you have, a child in one room and then a child in the same room, and you have a staff in that room, but they're not related anyway, then that would be considered an outbreak. And so then there's a little bit different communication for an outbreak. And that communication is that you would be still contacting your DHS licensing consultant when that happens. And then the DHS staff person actually is going to contact me. So we're going to do some tracking of that when it's an outbreak, okay? And then I'm going to work with the local nurse consultant. I'm going to work with local public health, and then we're going to collaborate and give you some guidance in terms of what you need to do with that outbreak. So I think the important thing is that, we're still looking at that positive case of 3 or more, and it's 3 or more in a 14-day period. And the reason it's that is because, what happens is sometimes you'll have your first positive case, and so it was just in one classroom, and all of the families are notified, and so the children that had exposure to that individual are quarantined. It was 2 staff members; those 2 were quarantined, and then that's why it's so important to have that communication with your staff and parents during quarantine, because then if there's a second positive case, and then there's a third positive case. So sometimes that happens after the fact, after that first initial. And so that's why that communication is really important for tracking. And then, like I said, there will be that collaboration. So your role really is to just start with contacting your DHS licensing consultant, and then they'll kind of start that. Now you'll still be kind of going back to the front of the page of that document, is you would still be talking with your families. You're going to be looking at who's affected, the close contacts, and determining, you know, how many individuals are involved, and then also, you know, putting in those protocols for your cleaning. The link for the is actually on the handout, the second page of the handout, that has the cleaning and disinfecting guidance that you would do if there was someone that was that ill in your, or with COVID-19 in your building. The other thing that's going to change is that, you know, if you're remaining open, you're going to implement screening procedures for staff and children for fever and symptoms throughout the day, and that's going to increase to twice daily. So right now we're doing temperature monitoring for once a day, and that would just change to then twice a day because of the situation. You're going to need to consider closure based on availability of staff and other factors. So I know in the past we our initial guidance document was really, it was, you know, with the guidance from DHS and nurse consultants and from local public health, trying to make that decision if you would need to close or not. And so there may be some situations where you'll be directed to close the whole program, but it's really going to, there's going to be a lot of factors involved in terms of, you know, who's been exposed, how many children and staff are going to be out of your on, you know, for 14 days that they're going to be out of your program. So there's some different information that you're going to have to kind of work through, and that's what we're here for, is to help you with that. The important thing too to make sure is that you're doing that notification for the families, but definitely maintaining confidentiality. That's really important. So I think the quarantine is the challenge. That's a 14-day quarantine. That's a long time. Families can get upset, you know, about that. But I think that's important for us to make sure that families know that that quarantine guidance has not changed, and that we are just following the best practice, because we don't want, really, if you have one case and you quarantine, we're really hoping to not have an outbreak. That's what we're trying to avoid, is an outbreak of more cases and more cases, you know, and then it really affects your program for a long time. So we really want to try to prevent that. That's an overview of that new guidance document. And then I do have some additional information that I was going to kind of just highlight, but I didn't see any chats come up, but my screen's a little different. So Brenda, is there any chats that have come up just yet? Any questions?
I do not see any at this time.
Okay, so I'll just continue to go on, and then if we have questions, unless Ryan needs to pop in at all. I know she's on the call, so I'll just go to the next slide here. So a little bit more about the health checks. So the CDC guidance and Iowa Department of Public Health, you know, are continuing to follow the recommendations for childcare that remain open. And that guidance document has been updated, but it has been pretty standard since the end of April. I think there has been a few little updates, I think, but that's about it. So just really looking at that guidance document for programs that remain open, and putting into place, making sure you're doing those health checks, looking at all the symptoms and not just the fever, temperature, and fever, cough, and shortness of breath, but really looking at all those health checks, including all of those symptoms that I talked about earlier. And the temperature monitoring, that you would increase that to twice a day if you have an outbreak situation. And then putting into place, you know, with temperature monitoring, I know that's been a challenge, but we're going to continue to do temperature monitoring, I think, for a long time. So if you haven't put in a way to do temperature monitoring with the preferred method, which is where you would have a barrier method. So you're meeting a child at the door and having a barrier method while you're whoever's doing the screening. That really look at that guidance document on the CDC and look at that barrier method. And that's where there's just more protection with having some kind of screen, either a plexiglass or plastic screen, so that you're protecting the person who's doing the monitoring at the door. And if you need help with that, reach out to your local nurse consultant, because they know your facility, they know kind of your layout, and they can help with that. So I would really encourage you to put that into place if you haven't already. This is something that has come up, and I just want to bring this to your attention, is children or staff with illness, and if they have a pending COVID test, do not have them in care, and make sure you have communicated that with your parents. I have had 3 recent situations of children that had pending results and continued in care because they were asymptomatic, and the parents never told childcare that they had pending test results because of a potential exposure. And you know, we cannot have children, because what happened is then when the results came back, which was 3 days later or 5 days later, and they were positive, then you're going back to, you know, now you've exposed this whole group of kids and maybe more kids and staff. So if children or staff have that pending, if they have illness or they have a pending test, they need to be excluded. And then the social distancing strategies, and this is where I'm just going to say, to safeguard your program, if you haven't already put in the guidelines of not having, and I see I have a typo on my PowerPoint, but avoid mixing of groups. Put into place that you're really keeping children and staff in the same group and not mixing, or not having floating staff, or not having kind of the staff that are working with, you know, covering during lunch or during different things. And I know that's so challenging, but I will tell you, the programs that have been able to put those in place, when there is an exposure or a confirmed case in, say, one room, then it's only having to isolate or to quarantine that room and that staff. And it's so much easier for the program to remain open than when you have a staff who maybe has been in, you know, all of the classrooms or floated from one to the next. And so then what happens is then all of the exposures are to quarantine for 14 days. Well, that really shuts the door down. And I know programs that's very hard and frustrating. So just that's just one thing in that guidance document, to reread that guidance document called Guidance for Child Care Programs That Remain Open on the CDC website, and look at especially those three highlights that I have on there. The other thing is that the cleaning and disinfecting your facility, there's a direct link on that outbreak responsibility guidance document and that case reporting. So there is a direct link to cleaning your facility when someone is sick, and then that consideration of how you would clean and disinfect. And the important thing to, you know, to really remember is, you know, if that person has been in that room, you know, in the past, we always said kind of to consider doing a short-term closure. And I'm not saying that that guidance has changed a little bit, but the CDC still says that, you know, if you have a positive case and you're trying to figure out, you know, what you need to do, or you're trying to do those case, you know, try to figure out who's had the exposure, you might, you know, consider to do like a 1 day for sure, because then that'll give you 24 hours that you can ventilate that room before you go in and clean and disinfect. So that's something that I would just say that you might consider that. And that's really determined, you know, that's your decision to determine that. But that is helpful, and the CDC still has that on their guidance document, that that ventilating the area and by opening windows and then going in and doing the cleaning and disinfecting. I want to visit a little bit. Oh, we've got a question.
Before you go on to that next one, I did get a message in the chat. They're asking, I think this was in reference to your statement about a child that's pending test results. What about parents that are having pending test results?
I'd have to look, I'd need to look this up. So I want to just preface it with that. But in my understanding of the guidance is that if somebody is pending a test result, a family member is pending test results, that their family needs to be quarantined. So that, and I think that general guidance still continues. So, and that would be staff, you know, staff too. because they're living with someone who's pending test results. So, or
All the
if they've been diagnosed, of course, then if they're diagnosed and it's positive, then they need to be quarantined also.
Yeah, and I guess just clarification, because the tests are so much more widely available now, we know people that people can just proactively have a test now. But
Correct.
we're talking about people that have a pending test result because they've been exposed or potentially exposed to somebody who's positive.
Okay, well, I will double check on that guidance,
Okay.
okay, because I don't want to give incorrect information. So, and then I can follow up on that if that's okay. Any other questions? Okay, I'm gonna visit a little bit about children with special health needs. This is a challenge, and I do want to provide some information about the use of nebulizers versus inhalers. So, you know, we really, I mean, I'm just going to say overall, the CDC has been clear about this, and so has IDPH, that individuals that are at high risk for severe illness should not be in care right now, in group care, and that's challenging, but that is still the guidance. Now we know that doesn't always work for families. So the important thing is to make sure that that children, if they have special health needs, and it's definitely more like a respiratory thing or an allergy, that you want to make sure you have your care plans in place and that they've been updated if needed, because you're going to need to follow those and really make sure that the child isn't having a health issue, and it's really just that they have their, you know, that's their seasonal, you know, allergies that they have, and that they maybe are having some issues with asthma. So some guidance that has come out with the whole around those action plans is that if there's a nebulizer that is ordered for the child, that the family needs to ask the physician, and this has been guidance that has been given to pediatricians and to physicians, that they should switch from a nebulizer to an inhaler for treatments. So in childcare, that you would not be doing nebulizer treatments. And that's a challenge in the infant room, but even with some of those younger children, they can switch to an inhaler with a mask and a spacer. So they have to have a mask and a spacer using that inhaler for those kids. And the reason is that for any of you that have done nebulizer treatments, I mean, you know, there is a lot of aerosol that is happening. So, you know, when you're doing that treatment, there's a lot of aerosol that comes out of the nebulizer mask and vent. And so there is a concern for risk that if, say, the child had, you know, was experiencing symptoms of COVID that were, you know, you weren't aware of, or maybe were asymptomatic, that they could be aerosoling, and that would be a high risk activity for the person that was providing the nebulizer treatment. Now, the studies that have been done have actually been done on healthcare workers working with patients that have COVID and the potential for exposure. It's a little different because in childcare, you know, it's not healthcare, and it's not like a healthcare provider that's working with a confirmed case of COVID positive case. It's a person that a staff member who's working with a child who's well, but just needs a nebulizer treatment. So, but that is the guidance. And so I just wanted to make sure that you were aware of that, and that if you have kids in care that are they have a nebulizer for their asthma action plan, or for maybe they have some allergy issues, to make sure that the parent refer the parent back to the provider to update that plan and switch them to an inhaler with a mask and spacer. The questions I've been getting a lot of is, how do you tell when it's, you know, asthma, seasonal allergy, COVID, you know, a runny nose, those kinds of things. And that's why I think those action plans are really important, because on those action plans, you'll know the norm for that child. So if they normally, have a runny nose because that's their allergy and that's documented, then you can see that as that's their norm rather than a new symptom that has occurred. Similar to kind of asthma. I mean, we know kids with asthma generally have coughing, they do cough. And so if you have that documented on their action plan, that's one of their symptoms is that they will have coughing, that then we know that if the child is well and they're not having an exacerbation of their asthma or they're not having other symptoms of COVID, then we can be more confident that it's just their normal disease that they have because they have a chronic disease. So that's why it's important to make sure you have those care plans in place. And if you need help with getting care plans, worked on, please reach out to your local nurse consultants so they can help you if you have any questions on that. And then that, like I said, those symptoms with the seasonal allergies and all that, there's actually kind of a good, helpful little symptoms chart that was developed for colds, flu, allergies, and it has some different symptoms on there. So that might be a good chart. And here's the link, and we can, that's from the Allergy and Anaphylaxis Agency. And so we have the link there, and definitely I can share that link maybe in the chat box so you guys have that, because that might be helpful to print that poster up, or ask your nurse consultant if she can send that to you, and you could post that in maybe a classroom or in the front. So the next thing I just wanted to cover are a few questions that we kind of keep getting that keep popping up. So I just want to share some of those common questions that have come up to at least across my desk, and then share some guidance on that. So just so you know, travel in the US, there is no longer a recommendation that you need to self-isolate for 14 days after travel in the US. But you need to make sure that as long as the traveler, so this is kind of the caveat to this, as long as the traveler remained well and has not been identified as a close contact of an ill individual. So we have a lot more travel happening with the summer months and family visiting and all that kind of stuff. So just know that isolation guidance for 14 days from in the U.S. travel is no longer a requirement. But if that child or staff is exposed, had a potential exposure, or it was a close contact of somebody that was identified that COVID, then they would need to quarantine for 14 days. So, and then they just say that individuals should continue to make sure they're washing hands with soap and water for at least 20 seconds, and or using hand sanitizer if you don't have that available. Always avoid touching your eyes, nose, and mouth. Avoiding close contact with others, maintaining that social distancing of 6 feet. And then really trying to be away from anyone that's at higher risk or sick or ill. That's an important one. Wearing cloth face coverings in public, I think that's really an important one. If I can't, and I'll just share, I know there's different information about face coverings, but when I'm out and about, if I can't maintain social distancing, and you know how that is, like, if I'm, outside of my home and I'm going for a walk, I don't wear a cloth face, a face covering. But if I'm going to go into a store to go get, some of my groceries, it's just hard to stay 6 feet away from people, and people, get kind of in your space, in your zone. And so I just think, err on the side of caution and wear your cloth face covering when you're out, so you can help protect yourself. And then I know for international travel, they do still have restrictions. So there is on the Centers for Disease Control, there's an actual travel page. And so if you have families that are going to do international travel, they will need to quarantine after that, or self-isolate after international travel. So if you have some family that are, maybe they're flying to, down to, the Caribbean or something like that, then you would need to follow that. And that's on the Centers for Disease Control website. Water play. I get a lot of questions about water play, and I guess I would just say, best practice, if you're kind of wondering, well, should I use water table. Should I, how are we going to cool off and stuff? And I would just say, really think about using small watering cans that kids can, fill up and they can sprinkle on their legs and their toes, when they're outside, and or small, like the little small individual buckets that you would see that you, like if you were going to play in the sand, sprinklers, things like that. The challenge with water tables, I'm not saying that there's any best practice guidance that's saying, oh, you shouldn't use any water tables. But the problem with water tables, a lot of times, is definitely kids like to drink out of them. I mean, I've seen it. I've been on site. It's hard, even when you're supervising, they like to, if they're filling cups up with water and they're just standing so close to that table, sometimes they like to drink out of it. And that is a really high risk situation, of course, for COVID spread. So that's why I think we're kind of saying maybe not use your water table, but just so you're aware of that. Of course, with any water activity, you always want to make sure they're washing their hands before and after they've done the water activity. And then, of course, best practice, we always say wading pools are not to be used in childcare. There's just such a risk for disease transmission with a child in a wading pool, and different children using the wading pool. So, we don't, it's different than I know the pools have opened up, or some pools have opened up, and, they chemically treat pools and stuff, but you just don't do that with a wading pool. So, and then there is a real high risk wading pools with drownings, if you look at the drowning statistics. So wanted to talk about that. And then cloth face coverings, like I said, I just shared a little bit about that, but I know some programs have maybe initially weren't using cloth face coverings. I think more programs are now for staff, some for children too. So there's some great guidance on the CDC website about cloth face coverings and what to do with those. We always say though, for children 2 years, under 2 years of age, they should not wear a cloth face covering. Some things to consider is, who's going to supply them? Are you going to have people bring their own? Best practice would be that you would use some kind of permanent marker on them with the person's name, so you can and actually wash them at the facility, so that in the next day they would have, and they usually, I think most programs have 2 for each individual, and so they're washing them and then having them dried and then putting them back into their into a cubby that's safe for keeping it clean before they put it back on it the next day. And then that just avoids that whole sharing back and forth of cloth face coverings, which I think is really a high risk behavior of sharing those masks. Masks should not be worn when they're napping, and then should not be, they can't wear them when they're eating. And so that's the other thing is, can you maintain social distance when they're eating or trying to do that spacing? And that's really a challenge. Making sure that children avoid moving the mask around if they're wearing them, and staff. It's hard to not adjust your mask constantly, but you should be washing your hands frequently. Wash your hands before putting the mask on and after removal. And then if the mask gets wet or damp, it should be replaced. So I know some programs are doing a thing where they'll switch them out after nap for the kids. When they get up, they'll put on a new mask. So that's a little bit about cloth face coverings. And like I said, there's some great information on the CDC website on those.
We have several questions. If
Sure. Yeah.
Pause, and I'll just ask them to you in the order that they were put in. So Jeff asking, what are suggestions for children being treated for croup, especially with the use of nebulizers, and would they need to remain out of care until their treatment is over?
I guess I would go back to the kind of that, well, they've been diagnosed with an illness and croup, they really are ill and shouldn't be in care. And that's kind of a general guidance that I know the DHS has always said, is that really ill children or ill staff should not be in care during this time. So that could be problematic, I know, for a family, but that would be the recommendation. And definitely if they're on with a nebulizer treatment, that just would not be, that would be a high risk situation for your staff. So I would say exclude.
Okay, next question is, what about sensory tables with dry materials?
Yeah, drying materials, yeah, that their sensory tables can still be in use. And like we always say, wash your hands before and after using sensory tables. So no concerns with those. It's more just the water tables with the, kids like to drink and
And
use
I
the
think
cup.
there was a part 2 she put further down, or Play-Doh. So
Yeah,
the same answer,
yeah,
but
yeah, that's good.
okay. And then the question is, if parents work in a facility where there's been an outbreak and the parents don't have symptoms but are being tested, are the children still okay to attend?
I'm going to go back to that, kind of my first thing where I need to look up that, because I really want to make sure that I'm clear on that with that, because I do know we have, like we'll have testing for the whole facility, and we're waiting for those tests. So I'm just kind of write myself a quick note, and I will follow up with you on that one.
Okay, and then are centers required to have staff wear face coverings at this time?
There is no requirement. It's a recommendation.
And then a question is there a recommendation for a dryer versus air dry, or an oven for mask drying?
The CDC guidance, I believe, is to dry in the dryer. I think that's correct. I'm not finding it in my little notes here, but that's what I believe. So I will double check on that one also.
Okay. And we have a question asking about school-age classrooms. They have children coming from different schools and different classrooms. Is it a good idea to continue to take school-age children from different schools and classrooms?
Yeah, that's going to be that's a challenge for programs, and I think having some good conversation with the for school age, it's really hard to group because you're mixing. I mean, and that's just part of the challenge. But I think the best that you can in terms of trying to limit some of that mixing, if you can at least mix, in terms of keeping, if you have a large group and you have kind of assigned to a group, keeping the same kids from the kind of the same, if they're all riding the bus together, that group would stay together. But I think that's going to be a challenge for a lot of programs. Any other questions?
There's one more question in here.
Okay.
Like another director has answered, so I guess we
Okay.
confirm. She's asking, can children still bring their own blankets for nap time? And if so, should they be sent home daily or stay at the center in a bag?
I believe, and I will look this up, but I believe that we are recommending that they not bring cloth or actually any toys, just because from home. And that would include like blankets and things like that. So to just maintain those ones at the program rather than kind of that swapping back and forth. So, but I will double check on that one too.
Okay, and that is all the questions I see in the chat right now.
Okay.
We've got about 15 minutes left.
Okay. So just wanted to share, so we do have still on the Healthy Childcare Iowa website, and I just kind of did a screenshot, but so if you go to our website and you look at the tabs here on the side, there's the Child Care Nurse Consultant tab, which is where you would see the map and all for our nurse consultants and the contact information for those. And then under the printed products section is where we have, our a lot of our information on there. I know most of you are familiar with using the printed products section of our website, but we do have a COVID specific section. I monitor that and keep that up to date so that you can, find guidance documents. And actually the DHS and IDPH, the new guidance document is posted on there, but also CCR&R's website is on there. They have some great resources on their website. And then just some of the direct links for the CDC. Sometimes it's challenging on both the Iowa Department of Public Health COVID website and the CDC to find things, and so we tried to do some direct links just to help you out for that. And so we still have that on the Healthy Childcare Iowa website. I know a couple things that we've had on there. We've had some questions on the medication administration. We had an extension of the med skills competency test outs, which are every 2 years, and for some programs annual. And we did an extension for those through the end of this month, and are right now trying to decide with DHS if we would need to do another extension. But we do have nurse consultants now that are starting to come out in the field. And both the American Heart Association and I heard today that the American Red Cross are allowing the test outs for CPR to start happening. I know American Heart actually started, I think, June 1st, but so we're seeing more of those opportunities available. And so we will we'll want to resume our med test outs so we can get kind of caught up with that. So there's some guidance that'll be coming out for our nurse consultants. And it's really, I'll be honest with you, it's very agency specific and it's really community driven. So as you know, we have some communities where there hasn't been any positive cases. And then we have other communities where there are quite a few. And so local agencies make the decision in terms of if they would go on site, because there is a risk when you go on site to any program. And we really want to limit on-site visits. So we're going to try to do as many things virtually as possible. And and training also. I did actually a training, we did the asthma training, nurse consultant and I did that just on Tuesday night this week. And it was great. We had really good feedback from the staff that attended the training. And we're going to try to do virtually as many things as we can, but we do know that there are certain things, especially our assessment tools for QRS and our med skills test out, and then the nurse consultants who do also CPR, because we have some that are CPR trained, and those are things that have to be done hands-on. And so we're just providing some guidance about how to do that safely and looking at the national models. Both Head Start models and then also the protocols that American Heart put into place for those face-to-face types of activities. So just so you know that those that med extension, med skills competency extension for the certificates is still on our website, and just keep, you might want to look back at it. I need to make a final call with DHS to see if we'll extend that for at least another month. But we would like to start working on that. The other thing that is on there too is still the CPR extension. There's some guidance on that for CPR. I know most of the CPRs are going to be a blended course where we'll do some of it online, and then they'll just do the test out part for the actual hands-on skill. And then a couple of things just on our website. You know, we've got quite a few links for different resources that are on there. So if you haven't been on our website for a while, I would say, you know, go and look at that. We updated recently our medication administration, the front and back page for administering meds in childcare. For the, I want to say report. Is it report? I can't remember the title, but anyway, sorry, little brain labs there for a minute. But our that documented, that reporting form that we have for meds, and we just updated it because there's been requests, and it's something that's been on my list for a while. So I finally got to it, and I'm sorry that it took me so long. But we added signature lines and initials on the bottom of it, which has been a big request from programs for quite a while. So if you haven't downloaded the new form, I would encourage you to do that. And probably the next thing, just our map. Wanted to share our map again. And we have, I know most of you know your local nurse consultants, but if you don't, please reach out. And that's all I had, unless there's additional questions.
Of course, we have additional questions.
Okay.
The question is it okay to have a morning class, then an hour break, and then an afternoon class?
So, so different children coming into the building, kind of like, are you thinking like a?
That's my assumption, but Melissa, you can unmute yourself if that's not the case. I think that you meant 2 different sessions of classes.
Yes, we have a class of 3-year-olds that would come in the morning from 8:30 to 11:30, and then we'd have an hour break. And then from 12:30 to 3:30, we have a class of 4- and 5-year-olds coming.
Okay. So do you have some procedures that you've already considered to put in place to clean and disinfect between the groups coming in?
We will. We're a preschool.
You're preschool, yeah. So
We
you definitely want to do that. You know, the hour is going to be a little bit of a challenge to make sure you can get that. You might want to consider how you're going to do your toys, because that's the hardest part, is how are you going to get, you know, any of your manipulatives between those two groups. That sharing of manipulatives, I think, can be challenging, and to make sure that those get cleaned and disinfected. So you might need to think about that. Think of how you could separate those out, so you have kind of the morning group toys in the afternoon. So you're nodding your head that you've already considered that, so that's good. And then the staff, I think the staff part is going to be your challenge, because if I'm just going to be honest, if you have the same staff for both of those groups and the staff person was positive, that those two groups would then be exposed. So you know, challenging to work around that, I think, but just so you're aware. I think definitely the staff person, I would monitor for health issues between those groups too during that break.
Okay. Yeah,
I think that'd be a best practice. It's just a recommendation. It wouldn't be required, you know, but I would just say for best practice.
Okay, so the best practice would maybe not have the morning and then afternoon class. It would be best if we just had one class a day and then have another.
Yeah, that would, I mean, so, I mean, I guess I'd have to look at, I know those schools are really working on those models, and I'm not as involved in the school models and the protocols with schools, but so there could be possibly some guidance out there specific to schools and how they're going to do that. You know, maybe like an every other day kind of situation I could see where you know, weren't doing that mixing. But that would be something to reach out to and I know they're working on those protocols right now. So if you have somebody at your school district, I would definitely reach out to them, because you might have some additional guidance on that. So
okay,
great question. Thank you.
Okay, and then question is maybe not a question for you, but if med admin classes are going to be offered soon, that might be a regional decision of when we have classes scheduled. But is that one that has a component of hands-on?
Which class?
Would it be done virtually? Med admin?
Med admin is a hands-on. So we actually, protocol will be coming out. Our nurses will get that on Monday for the hands-on portion, and we're following the same protocol that American Heart has kind of put into place, and we actually had some other guidance that came out from IDPH. So we're finalizing that protocol, but that's a hands-on. So we'll definitely need to be in person on those, and then trying to figure out if that would be on site in the facility. I mean, there's a lot of those kinds of questions that'll need to be figured out.
Okay, next question is, how would close contacts be monitored and determined in a small group setting?
Well, I think if you're all in the same group and you know, the children are all together, it would be hard if they're not social distancing, which I don't know how you would do 6 feet and then not have them in the same space within 15 minutes. That it would probably be that they would all be considered close contact. So that's where, you know, we get some of those questions in terms of close contacts with, you know, say maybe it's a staff person, and, you know, if they're all in the same lunchroom, meeting room, or, you know, or they all are taking a break together, you know, that potential for exposure is there. But if you're having groups separated and staff not doing kind of those community type meetings or community get-togethers with the staff, then you may be able to say, well, there wasn't any close contact that occurred, even if they maybe, you know, were in the same building at the same time, but they just weren't within 6 feet of each other for a 15-minute time period or more.
Okay, and we've got a few more here. We'll try and call in. How often do they need to take children's temperatures during the day?
Right now, and Ryan, you might want to jump on, but right now it's that DHS is requiring that just once a day, unless it's a situation with positive cases. Is that correct, Ryan?
Okay. Oh. Okay. Am I unmuted?
Yes, you're unmuted.
Can you hear me? Okay.
Yep.
Yes, that is correct. If they're after we have positive tests or anything like that, we might recommend doing it more often, but right now it's just upon arrival.
Thanks.
Okay. Next question, do we need to get paperwork from the staff or families that their COVID test was negative, or just take their word?
I had a question of that come up earlier, and I had to reach out to Iowa Department of Public Health because I'm just not sure how that works. I think I'm not sure how to even answer, because I thought that you could ask that to be shared and that would actually share their test results. And that's what I've seen from the business kind of side, is that that's something that's a shared result. But I had that question come up today, and because they were having a challenge, the director was having a challenge to get the results from their staff person. So I'll have to look that up. Hopefully I'll get that information back today. But if not, that's a good question, and I'll have to work through that. Unless, Ryan, do you know that by any chance?
No, I do not know that. And I think it's a really great question as well.
Yeah.
I just don't know the legalities of requiring a result to be shared. I don't know.
Right, because HIPAA still applies, so that may be, if it's in a workplace, may be one of the hiccups. So
yeah.
Okay, I only see one additional question in the chat, so if people have other questions, get those in the chat. The last question I see is, what is the recommended class size? Is it still 10?
Oh,
Yeah.
I think it still is. Is that right, Ryan?
Yeah, so,
okay.
And that's one thing that I do want to be clear about is, yes, the recommendation is 10. We understand that that may not be feasible for programs, and that's why it is only a recommendation. And I know that a lot of programs they want to follow DHS recommendations and treat them as requirements, but please understand, do your best with that. Especially those groups where maybe you've got the school agers that are in a large group setting. You might not have a class size of 10 individuals, but potentially you're breaking those kids out into smaller groups to reduce transmission or spread kind of cross groups. So I do, it continues to be a recommendation, and I think it probably will be for a while.
I see your question here from Little Bulldog, and that's kind of what I wanted to say here as we wrap up these last couple minutes, is just, if you have additional questions, put them in the chat. We did want to let you know all the programs. If you're having trouble getting any kind of supplies, which is Little Bulldog's comment here, trouble getting gloves, reach out to your local child care consultant, because we have access to people that are kind of specialists in ordering this type of material. So if you're having trouble getting things, soap, gloves, thermometers, that sort of thing, just reach out to your child care consultant and we can assist with that. I'm not sure if there's anybody on here that wants to respond directly to Little Bulldog to say if you are or are not having trouble getting gloves. And then before, it's not going to end immediately at 2 o'clock, but I want to be respectful of your time. If anybody that's on this session was expecting DHS CARES Act money, either as a basic monthly stipend, the stipend for essential worker discounts, or the rejuvenation, you should have received that. So if you have not received that money, there is an email, I'll put it into the chat, the Can We Help at DHS that can assist you with that.
Brenda, I'm going to jump in for you just a second too. Just as a clarifier with the stipend, the monthly stipend and the essential add-on stipend. So for example, if you apply for the April stipend, the May stipend, the April essential add-on, the May essential add-on, those are going to come in individual checks. So you will not get one lump sum per month. You will get individual checks because we have to break them out through like a billing code. So when you receive a check, it will specify what exactly it is for. So if you applied for both of them during the April and May, then you would get 4 checks separately. So everyone should have those. Again, use that "can we help" address that is in the chat box. If you have not gotten those, please know that it's just me behind the "can we help" box. So there's so if I don't get back to you right away, it's because there's only one of us, and I have to go through spreadsheets and all that to find what might be missing or what might be going on. For rejuvenation grants, Wendy Hugabane is kind of managing those, and those go down every Monday down to fiscal to get payment out. So it just kind of depends on when you apply as to how quickly it goes down to the fiscal unit for payment.
Okay, and it looks like we had a couple questions come in during that. There's lots of responses about places that have gloves. So if you were the one asking about gloves, there's some resources there. Amy's question is, her preschool is in a church, and are there any restrictions like no others using the classroom or children that should not be in the shared church spaces, or as long as the rooms are cleaned in between uses, is this okay?
Yeah, the guidance that I've seen is that they need to be doing the cleaning and disinfecting using a disinfectant that is, that kills COVID or works for COVID. And, if it's been more than 7 days of that shared space, then there's no additional cleaning that's done. Definitely, I would, it's really challenging. The shared space, you might be doing the cleaning and disinfecting and needing to do like the tables and the chairs and all of those things. But if you're allowing like toys to be shared or any manipulatives to be shared or any equipment to be shared, I would say that's a challenging, for you as a provider to come back and have to make sure that all that has been cleaned and disinfected before you use that facility. So maybe having a conversation about having separate items that you would, put in bins or whatever, so that they were designated so you weren't sharing those items.
And we've got a couple comments in here of people thinking they're getting some inconsistent results from their no-touch thermometers, like they always read the same thing. So recommendations about that?
Well, definitely go on the website of the company that your thermometer is through, because I know that there are some helpful videos and helpful hints in terms of making sure that you're in the right distance away for the person when you're scanning. And there's I've looked at quite a few different models, and most of them have helpful hints or concerns if you're having concerns about readings. They are and it would depend on the brand that you have, but the brands that I know I've looked up, most of those have been certified. So, I always say too, if there's concerns, if it's a battery, I know with any kind of thermometer, sometimes you can get inaccurate readings if your batteries aren't strong or they're starting to get weak or whatever. So that would be something to consider, but reaching out to that supplier, that company that you got it through.
Okay, well, I do not see any additional questions, so thank you so much for joining us again, Heidi. There was a comment asking about these Zoom meetings going forward, and yes, as long as Heidi's willing to, and it works with her schedule, we do want to do these at least monthly, just knowing that really there's no end date in sight at this time. There's still lots of positive cases around the country. There could be spikes. Who knows what's going to happen when kids go back to school or if they go back to school. So we will definitely plan on continuing to have these once a month. We will have one for home providers next week as well. So if you know home providers doing care that maybe it didn't get the invite, feel free to have them reach out to me. And I think we'll just wrap it up. So thank you so much, Heidi, for all this great information. And thank you to Ryan for popping in and answering those questions.
Yeah, Brenda, hey, invite me anytime. And if I can pop on, I'm more than happy to do so.
Thanks so much, Brenda. And I will follow up with, I have my little list of things to check on, and then I will follow up in an email, and then you can send that out if that would work.
Yeah, I think that sounds great. And kind of what we've just been, processing, because we've had a lot of Zoom things lately, is it will get posted to our website. And so I think we're just going to ask Bobby, when she posts a link to the recording, if we can just have another link right next to it for these questions and answers. That way, even people who weren't participating today can see those questions and answers. I think that would be helpful for everybody.
Okay, great.
Okay.
Thank you.
Thank you.
Bye.